Well, the US hit a horrible milestone today, 4 million cases of COVID, and on the same day we've received new research that shows that, in a word, we crushed it.
We crushed it. It's 3 words.
Not the point.
On March 25th, New Zealand was one of the first countries to lock it all down.
We must go hard and we must go early, but our journey will depend on how we work together.
A total of 22 people died and 1,555 have been infected. And now life is kind of back to normal. We are the envy of the world, because out there it looks like a COVID dumpster fire. We got lucky, right? Well, a new study found it wasn't all luck. Massey researchers say nearly all of us just got it. We knew how the disease worked, how it spread, we washed our hands, kept socially distant, and we didn't buy any nonsense.
And then I see the disinfectant where it knocks it out in a minute, 1 minute.
Thanks, big guy. Here's the thing. Massey says we trusted our leaders. The PM and Ashley got nearly perfect marks. We did the hard yards. And here's a thought. We trusted the science. Well done, New Zealand. Now go wash your hands.
Dr. Jagadish Thaker is one of the researchers behind this study, and he joins us now. JT, why are Kiwis so great? Why did we succeed at this?
In public health, we say you have to sort of motivate the elephant, direct the rider, and shape the path. And I think we did as well because we had a very good leader, and we trusted that leader to deliver, and she did. So I think coming from the top, but also speaking to us, not just being told down, but spoken as adults and sharing the care and the concern. So that was important in bringing people together rather than just talking down to people like, I'm an expert and you are a layperson kind of a thing.
OK, so communication, that's one thing, but surely we did something cool as well, right?
I think what we found was a sort of a concept of social norms, which is how popular are these behaviors with my family and friends? Would my near and dear censor me if I don't follow those prescribed behaviors? So that was very high. 9 out of 10 Kiwis, or even more than that, said that people, my family and friends, are doing these preventive behaviors, that it's important for people in my neighborhood that I do these preventive behaviors, and if I don't do that, my near and dear ones would look down on me. So that was quite high, the kind of a social norm that has been set up, and I think that could be the key for why people behave the way they did.
So, bullying and peer pressure, but in a good way. A lot of the findings about COVID-19 have been very positive then, but Kiwis, it turns out, are also worried about some stuff as well.
That's right. 9 out of 10 Kiwis said that their joblessness will increase in the next 6 months. 75% said cases of depression and mental illness will increase. A majority said other issues such as poverty, housing shortages are likely to increase in the next 6 months. So even though we are out of the woods, but not completely.
JT, you were saying, you know, great stats like 9 out of 10 Kiwis have done it properly and 8 out of 10 Kiwis. Is there any way that we can find these sort of 1 and 2 Kiwis, find out their names and give them a good telling off?
Well, I wish we could do that, right? So we'd know which doors to sort of knock. But these surveys sort of are anonymized, and these are sort of aggregated numbers. So, and it was conducted by Qualtrics, international survey firm. So unfortunately, we won't know where they are. I mean, we sort of know their average location, so maybe we'll go there and yell out and see who comes out.
I'll come with you. I'll yell at them for you. I'm happy to do that.
JT, thanks so much for speaking to us.
Thank you for having me.
Yeah, and if you want a reminder of how well we've done here in New Zealand, when was the last time someone told you we need to open the bubble to Australia right now? Or Australia did much less than us and look how good they're doing. I mean, you feel sympathy for them in Melbourne, but you look at what's going wrong at the moment, still hundreds of cases each day. People are getting tests and going to work while they wait to see what the test did, and it's all down to a lack of communication and no clarity around exactly what the rules are and how to follow them.
We are doing so well, and it's great to have that research, that evidence to show how we got here, but I just think we need to stop talking about it now in case we jinx it.
Right. But you can't follow the science and then say, let's not jinx it. Jinx isn't science.
That is not what my horoscope told me today.
Okay.
Well, I'm crossing 2 of my toes. It works for me.